Morning, all of you. So today's class would be on radiation protection. So what we are going to learn today is, I have, for your ease of learning, I have split the class into two. So it would be the persons who are getting protected from radiation and how do we protect radiation from, and what are the things that we use to measure the amount of radiation that a person is being exposed. So basically, what are we trying to protect the patients is from is of the following. So why is it radiation protection very important and very necessary is that because radiation exposure can cause somatic effect, genetic effect, teratogenetic effect, and radiation can deposit energy, it can damage the DNA, and can create free radicals in the body by interacting with the cell molecules. So you should always remember these three P's which are essential for radiation protections. That is, whom are we trying to protect? It is the patient, which is your primary concern. Then you have the operating personnel, that is, it could be either the dentist or any other technicians that has been involved. And the third would be the general public. So what are the effects of radiation? So based on the effects, you can have cell death, you can have cell transformation, or you have something which is involving the both. So these are the basic effects of radiation on human body or on the cells. It could cause either the transformation of the cells, that is the DNA repair, or it can ultimately cause a cell death or a combination of both. So radiation emitted by the X-ray tube are basically divided into four types. You have the primary radiations, that is before interacting with the photons. Then you have the secondary or the scattered radiation, that is at least one interaction, and leakage of radiation which is not absorbed by the X-ray tube and which is within the housing shielding. And the transmitted radiation is the emerging after passing through the matter. That is, after the exposure, it passes through the human body, then it comes out, then it is called as the transmitted radiation. So, what is the minimal dose and what is the maximum dose, and where should we stop? That is, where should the radiation be stopped to have an optimum point? So, we live around with 1 to 3 millisieverts, and then you have microsieverts, then you have the radiation of around 4000 microsieverts can kill a human being. So, this is which is the safe point, is that what's our primary concern. So culminative dose is the numerical value of the culminative dose is in terms of sieverts exposure and should not exceed the numerical age of a person. So for a 35-year-old patient, what you do is you have calculator and it will be 350 MSV. Then for guidelines for remedial action, the public exposure, the effective dose limits will be less than 5 millisieverts. So what is the difference between a gray and a sievert? Sievert is similar to gray, but it takes into account the potential ability of radiation to cause a biological effect on the human body. So absorbed dose is measured in gray and the biological radiation dose is measured in sieverts. So that is the basic difference between a gray and a sievert. So the sievert is a very similar thing to the gray, but what it measures is the biological effect or the biological damage that it causes. So where does this source of radiation comes from? So basically, as you all know, it doesn't mainly come from the radiation machines or the X-ray machines that we use. It is majorly occurring from the natural resources. So you have external and internal. You have cosmic and gamma radiations and radionuclides in the body that is being ingested or inhaled. Where you have medical procedure which contributes only around some 10 to 15% of the total number of radiation that is being produced in this surroundings. So the radon is found to be the most natural form of occurring radiation, and this is majorly it's a form of a natural gas, and so it is found in places like furnaces, fireplaces, heaters, stoves, and water heaters. So what are the principles of radiation protection? The principles of radiation protection is basically justification, optimization, and dose limits. So what is justification? It is whether the benefit of the use of radiation which outweighs the risk factors that is involved, Optimization, if the exposure is justified, then keep it as low as reasonably achievable. That is the ALARA principle. And the dose limit is the exposure should be within the prescribed dose limit. So justification, once again, it is no practice involving exposure to radiation should be adopted unless it produces sufficient benefit to the exposed individual or to the society to offset the radiation determinants its causes. So justification is basically, it is of the exposure is primarily the responsibility of a medical profession. So if you are a dentist and if you are going to take a radiograph, then you should have a justification whether that tooth or any other part of the jaw that is being exposed to radiation is totally significant. That is, you justify your operating procedure that you need an X-ray for that patient. So that is basically, it comes under the selection criteria. So when you select a patient, you should be able to justify the advice of a radiograph. The expected clinical benefit should always be associated with each type of procedure and should have been demonstrated to be sufficient offset of the radiation determinant. So optimization of the procedure can be obtained by able to achieve optimizing radiation. So it is also called as low as reasonably achievable, that is ALARA. This is called as the ALARA principle. As you can see, A stands for as low as reasonably achievable. So now it's the time to move on. So the ALARA principle has been changed to ALARA. So if a pretty picture that is, it can be easily explained in the following sentences. If pretty pictures are being obtained when only diagnostic image is needed, so you don't look for the clarity here. If you are able to diagnose a disease or a pathological thing without much of a radiation, then you have something called as diagnostically acceptable image. So that is what we are looking for. We are not looking for a pretty radiograph, or we are not looking for a radiograph which is in high quality, but if you are able to diagnose the pathology or the underlying any discomfort, then you can be called as diagnostically acceptable. And this has led to the new concept of as low as diagnostically acceptable, which has moved from the ALARA to the latest version, that is the ALARA. So these are the principles of ALARA or ALARA: the source elimination or the source reduction, that is called as the elimination, controlling and containing the radioactivity, minimizing the time in the radiation field, and maximizing the distance from the radiation source, and use of copper shielding and optimization rule in radiation.